Hi, Megan. Hi, Vadim. Thank you both for talking with us today about running for Multnomah County District 1. You guys were the two highest vote getters from the May primary, so you'll be facing off in November. And I think if we can just start off by having each of you give like a 1 or 2 minute introduction about who you are, why people should vote for you, that'd be great. And Vadim, why don't you go first this time?
All right, thank you, Helen. It's good to be here. My name is Vadim Mozyrsky. I'm running to be the next county commissioner because I have the experience to make sure our county is successful in addressing the urgent needs of residents here. My family, as a little bit of background, came to the United States about 45 years ago. We came from Kiev in the Ukraine. It was part of the USSR at that point in time. We were allowed to leave, but only with a few suitcases and about $90 each, which and during the trip we spent all that and sold off some goods. So when we came to the United States, we had very little. My family didn't speak English. I went to first grade without knowing any English at all. My dad took odd jobs. And I mention all that because I know what it's like to need help. My family got a loan for their first car. My parents got help getting jobs, odd jobs, until their language improved. My mom went back to community college and became a nurse. And I'm very thankful for all the help we received along the way from organizations such as ERCO here in Portland, but similar organizations where we lived. But there's a lot of people now that need help throughout Portland and Multnomah County. A lot of people that are living and dying in our streets, and a lot of other individuals that need the county to step up and do what's right. We have some green shoots. There's a lot of more activity in downtown. There's concerts. There's a prospect of rebuilding the Keller Auditorium, of putting a new auditorium in PSU. The OMSI is going to get remodeled. But until we address the underlying issues of homelessness, drug addiction, mental illness, and some of our public safety needs, we can't be a successful city and county. And so I'm here pledging that I will end the chaos of emergencies and crises that we've been lurching from one to the next by bringing a period of calm pragmatism to our local politics by running a more efficient and honest government. A lot of people ask me, what should we do? And I say, not what we're doing right now. We need change. And I'm running as a person that will bring change to our county commission so that we can have the policies in place to make sure that our tax money is spent effectively and we bring help to all those individuals that need it on our streets.
Great, thank you very much. And Megan, can you tell us a little bit about yourself?
Sure. Hi, I'm Meghan Moyer, and I'm running for Multnomah County Commissioner in District 1. I'm running because, like many residents of Multnomah County, I'm really quite frustrated with our response to the homeless epidemic we've had over the last 5 years. And I'm really running on three core issues that I want to commit to working on as a county commissioner. First is fixing our broken mental health and addiction system. The second is pushing for Preschool for All program to serve more families quicker. And the third is successfully moving chronically homeless individuals off the streets and into permanent supportive housing. I was born in Salem, Oregon. I'm the youngest of three girls. And I am now a Portland resident. I love this city. I came out as queer when I was 18, and Salem was not the most accepting place in 1998. And Portland was this safe haven for me. And it has always been a place that I have felt that I belonged and I grew through getting married and having children and building a career. And I love this community. And I am really touched by the fact that this community wants to help our neighbors. And so as somebody who works deeply in these areas of mental health and services to people with disabilities and homeless and housing, I felt like that goodwill was squandered by ineffective and poor response to this crisis. And so, I felt like I could either keep getting more angry or I could choose to try to step up and do what I felt that I could offer. I've spent my career building things. I've been a contractor. I've built low-income housing. I've built single-family housing. I also worked for a multinational construction company building clean rooms for one of our largest regional employers. But I've also been a public policy expert and I've worked in the area of services to our most vulnerable. And the way I have approached my career is to identify the problem and work and fix it. And I've done that by passing over 30 laws. I've helped design our Medicaid long-term care system. I'm at the table when we're talking about redesigning the Oregon Health Plan. I'm called to represent Medicaid clients when it comes to what should and shouldn't be covered. I've passed laws protecting vulnerable people in residential settings. I've expanded health insurance to over 30,000 home care workers who take care of seniors and people with disabilities. I see problems and I fix them. I love this city. I love this county. And I know we can do better. And so I'm running because I want to fix these problems and bring us to a place again where people are excited to be downtown and starting businesses, and people are doing well, healthy, and stable in our communities.
Great, thank you very much. I'm going to pause recording real quick. Great, thank you very much. Meghan, let's start with you on this question, and I want to talk about deflection. As you know, the deflection center that Multnomah County has been working on was supposed to open September 1st. Now they're thinking it's going to be sometime in October. I'm wondering if you can assess how you think planning for deflection has gone, and talk about what you would have advocated for had you been on the commission.
I don't think it's gone well. I think objectively, the planning has not gone well. One of the things that I'm not really sure, obviously, a lot of conversations happen behind closed doors, so I can't say when planning began and who was at the table. But I will say, I don't think it was a very open process. And I really want, as a commissioner, to push toward engaging the public, engaging stakeholders openly before rolling out plans that seem to be the set plan for moving forward. I have a couple of really big concerns. The first is there's an equity issue if you only operate between 8 a.m. and 8 p.m., because then you're offering different access to picking up a crime or not picking up a charge based on the time of day. And I think that creates some legal issues for Multnomah County. The second is I'm very concerned that there's nothing behind diversion. And what I mean by that is we're engaging with somebody, we're trying to give them an alternative to a charge or being booked in jail. And let's say they say yes. Where exactly are they going to go? Because we totally lack capacity in our behavioral health system. And I had this critique a little bit of 4002 because I worried if you're going to offer diversion, but there is actually no treatment there, that's not real. That's not a real lifeline. And I think Oregonians strongly support, and I certainly believe Multnomah County residents strongly support actual access to treatment. So I'm pretty critical of both. It's not 24 hours. I do think having a physical location, I know there are different models. Some are just having a conversation in some areas. I like a model in which you are actually physically taken somewhere. I like a co-location model. I hope we could look at that as a permanent location where somebody is going through the same door or makes a decision between doors between diversion or jail. I think it's very real for people at that moment. But I really don't want to miss opportunities where somebody says yes. If somebody says yes and they're ready to change their lives and we actually can't follow through on that, we may lose lives that way. So, I think as a county commissioner, if I could say the thing that I am most concerned about is that diversion or deflection isn't real because there is no treatment availability. And that will cause lost lives. And so, that is probably one of the things that we need to start being the most honest about, that we're not really diverting to anything.
Thank you. Vadim, same question for you. If you can assess how you think planning for deflection has gone and what you would have advocated for had you been on the commission.
Thank you. And this is one of those areas where I actually did advocate for solutions. I think the planning went horribly. Part of it is the fact that it was behind closed doors. So people learned too late, including our own commissioners and the neighborhood in which the deflection center was put into, what was going to happen. Sharon Meyer said she didn't learn until the plan was already in place and the signatures already on the contract for the building. And likewise, the Buckman neighborhood learned about things a little bit too late. Well, first of all, we need transparency. We need to have people be able to attend open meetings. We have open meetings laws for a reason, so we understand what our government is doing, what the plan is, and who's going to be responsible for what. I went to the Buckman neighborhood on several occasions to their neighborhood association meetings. They held a special meeting about this deflection center. Those individuals that attended the meeting said, we're actually okay with having a deflection center. We know people need these services. The Buckman neighborhood is very open to services for the unhoused as well as for a possible deflection center. What they wanted was the ability to have safety in their neighborhood and safety for their kids. The deflection center was put very close to a preschool, and parents as well as neighbors were very concerned about that. So one, we need openness. We need to have a lot of people at the table that have input. As y'all may recall, our newly elected district attorney was precluded from attending those meetings initially until Dan Rayfield stepped in and asked them to open it up. Next, we need to have evidence-based. We hear a lot about that. What our county, what our city does is evidence-based, but I can't find anywhere where a physical deflection center where someone is dropped off without detox beds being available there is a best practice. Now, I've worked for the United States Department of Health and Human Services, where I was started off as an attorney and then became a senior policy advisor over time, and a supervisor there as well. We have an organization within the Department of Health and Human Services called SAMHSA. It's the Substance Abuse and Mental Health Services Association. And SAMHSA actually contracts with an organization of which Multnomah County is a partner. And they have best practices for deflection centers, such as the LEAD model in Seattle, and quite a few areas, including Hawaii. Or there's other models as well. None of them call for an actual physical deflection center. Now, we do need a drop-off center, a sobriety center that, Central City Concern closed down about 5 years ago. We're way behind that. But this sort of hybrid model where it's not quite a drop-off center, not quite a deflection program, not open to the public, where people can have input and understand how it affects their communities, is what's making this thing fail. Now there's a lawsuit. People are against it that were initially for it. And we don't have a deflection program that we know works. And we could easily pattern it on a court-based system or a case manager system or something where a person checks in and they are on a path to sobriety, versus a place where you're dropped off and you can leave right away. So I think the planning was absolutely horrible, and we're seeing the results of that right now.
You touched on my next question, actually. So about a month ago or so, Portland Police Chief Bob Day sent Chair Vega Peterson a letter emphasizing the very longstanding and very urgent need for a sobering center. Do you think that the chair's plan to add some sobering beds to the deflection center in 2025 is the right answer?
It's not, because basically we're going to add the beds about, a year into it, a year before the whole thing gets torn down. So it's a waste of resources. What we need is a true sobering center that leads to detox. I hate to point to other counties around us and say that they're doing a better job, but here, Washington County is doing a better job. They broke ground recently on an 86-bed deflection, or not deflection, sobering center, drop-off center / detox, where people can transition from sobering up to stop use of drugs and then go on to transitional housing. That's a public-private partnership. They didn't have to raise taxes in order to do it, and they've already broken ground on it. 5 years ago, our own sobering center closed down because people were too violent because of the drug use that we have right now, especially methamphetamines. Well, guess what? Those people are on the streets right now, and the public has to deal with any kind of violence, as well as the homeless people that are sometimes the victims of that violence. So, there was a report that was presented by a group of people, including Bob Day was on there, but also county commissioners, city leaders, nonprofit organizations, providers of services, mental health organizations, as to what that sobering center would look like. And the county sat on it and did nothing. Most recently, Julia Brim-Edwards used the same consultants actually to draft a kind of a similar report, pared down to an extent, but also similar recommendations. Let's break ground on this. Let's move fast forward. The state gave us $25 million, but still to this day, we're not moving forward on that very needed resource for our first responders. Right now, the choices are jail or emergency rooms. And really, we're not taking people to jail for some of these crimes. So we're going to the emergency rooms, and they're not getting long-term treatment that they deserve. So once again, let's do what works. Let's plan for it. We already have the budget for it, but let's not kind of recreate the wheel and keep on having square wheels for our county.
Great, thank you. And Meghan, same question for you. Do you think that the chair's approach to adding sobering beds at the Deflection Center is the right way to go?
No, but I'll take it over nothing, which I think is sad. One of the things that I see, and I agree with Vadim, that I don't understand why we have not moved forward. And it's not okay to wait as long as we're waiting. It seems to me as if the county can't handle more than one project at one time, and therefore tries to shove everything in the kitchen sink into the project, and it sinks of its own weight. And I have it in the same location, have it nearby, have it. For me, I don't understand why we are not building out entire systems. And maybe, again, speculation, I don't have an inside look. It seems that too few people are being empowered to move forward on projects. And so they're over capacity. They can't handle doing this. And how are we going to respond to implementing 4002? And if it's the same 5 people, we need to have a clear vision of what a full system looks like, what components need to be in place, and we need to delegate teams to make that happen. And I think that that's not happening. Why didn't we have a deflection center 2 years ago is beyond me. But or a sobering center. Absolutely, we need that. But we also better have treatment beds right after. There's absolutely nowhere in the entire state for somebody with a dual diagnosis. So you have serious mental illness and substance use disorder to get treatment. That's not a new problem. We've known about that for well over a decade. I don't understand why the county's not capable of moving forward on multiple projects to fill out a system at one time.
Great, thank you. Meghan, if you can go first on this question, and you mentioned this earlier on, but there's widespread understanding that the county does not have enough treatment, residential beds, outpatient programs, et cetera. We haven't heard a whole lot about how the county should go about meeting those needs, expanding that capacity. What steps would you take to identify what's needed and move forward?
Yeah, I have several really concrete ideas, but the fundamental side of it is we have never built out a Medicaid-funded behavioral health system. We have a public health approach, largely, which doesn't really make sure that we're able to case manage an individual through a treatment continuum based on their unique needs. So for me, as somebody who's worked on Medicaid systems and building out Medicaid systems, like our state's long-term care plan, which I helped develop and I lobbied for Oregon to adopt, it's about understanding what Medicaid will and won't cover, what are the needed continuum of care, which will have some different paths depending on people's unique needs and population needs. And then knowing what we can get funding for, how do we work to make sure we've got a provider willing to serve that population? And I'm very interested on a systems level. I am not in love with any particular provider. I am passionate about the whole system. And, I am engaged in conversations now with Representative Rob Nose about what are the role of CCOs, and CCOs are coordinated care organizations that deliver Medicaid services here in Oregon. And in the metro area, health shares are by far our largest. Should they take on a role that they currently don't have, which is being in charge of residential care for behavioral health? They don't do that right now. And I think that's potentially something we should discuss. But also, how are we making sure that our outreach work, like Portland Street Response, can be done at a scale necessary to build relationships and bring people into services? I want to move it to the county. I want to put it under a federally qualified health program so that we can get a 3-to-1 federal match. And I want to quadruple the size of it because I want people to build relationships. And now, I'm working with public health groups around how can we get Medicaid reimbursement for non-ambulatory services in the community using billing codes that are used for traditional health workers. Is it nerdy? Yes. Is it wonky? Yes. But this is how you use creative tools to put a system together. And that's what I'm really passionate about.
Great, thank you. And Vadim, same question for you. There's widespread understanding of all the that there's not enough services for what the need is. What would you do to identify what needs to be expanded, and how would you go about making that happen?
So I'd love to hear more about Meghan's ability to get money from Medicare at a 3-to-1 match. I have not seen that online, and if she knows how to do that, I wish she would share with Oregon Health Plan and Oregon Health Authority. But there are some resources that are coming our way. Medicaid has recently expanded, so if you're in an emergency room and you're leaving, the hospital can actually bill additional codes or bill under a separate code for additional services to get you into a continuum of care, to get you into a treatment plan and to have it monitored. So the first step is we need to make sure that people are on a continuum of care, whatever that might look like for their specific needs. And we have that ability currently. Come November, Medicare will be expanded in order to provide housing resources for people that are in need as well as part of a health benefit. And that's coming our way, and I look forward to helping implement that. But these are kind of statewide issues. What the county can do is build out private-public partnerships in order to make sure that we have available space. Meghan recently mentioned about there being no places for dual diagnosis people to go. Unity has built out, I believe, about 30 additional beds for people with drug addiction, mental illness, dual diagnoses. We need to make sure that we further that. The tragic news today, in my opinion, was the loss of an 80-bed facility where there was a public-private partnership. A developer here in town, TMT Development, had office space that, because of the economy, was not being used. They had spent a lot of money to remodel it into Class A, seismically retrofitted office space. And they were looking to build detox/transitional where people with drug addiction, mental illness can go in order to be stabilized, because you don't want people to go back on the street, especially when they need stability and transitional care. Unfortunately, the county could not find, I believe it was $7 million out of a package of about 18 million that were needed to retrofit this building. So imagine that, $18 million to get 80 people at a time into the kind of care that they would need, detox and all these things that we've been talking about. And yet our county, out of a budget of $400 million of the Joint Office of Homeless Services, of which about 100 million, as I understand, are still waiting to be spent, are not able to meet that public-private partnership. And so we need to make sure that we are able to do that. I know that Commissioner Sharon Marin has offered the possibility of buying a hotel in order to turn it into a transitional center. And there's a lot of people that wanted to do that. Again, it'd be a much lower cost than what we're doing right now. So in order to get there, one, we have to utilize the resources available. So Providence, Unity, those sort of things to the maximum extent possible. But, we also need to listen to the experts, the people that are working that field. And we can build transitional centers fairly quickly. But we need to have the space. And it can't be my way or the highway approach where the county builds it out. We need to work together, similar to what Washington did when they partnered with other organizations and foundations to raise I believe, $60 million almost that they needed to build that center. And that's what I intend to do.
Let me follow up on that because I did see that story today regarding the Vanessa Sturgeon's effort to open the center. One of the issues, as I understand, was that the partner who would be providing the services would only accept private insurance. Should the county be committing money to a service where, you know, it is going to be only for people who have that private insurance?
So I kind of read it a little bit different. That person accepts private insurance, but I didn't think that there was a restriction on like OHP or something along those lines. You know, that being said, certainly there's avenues to go back and forth in order to make sure we're all on the same page. You know, there was a committee formed, and that was one of the objections. That was not the only objection. If they needed someone that was more local in order to address some of these needs, certainly that's a possibility. But what we need is that dialogue, and we're not seeing that dialogue. You know, I think OHP is a wonderful insurance. I'm pretty sure that they are able to bill at the same level that private insurances do. And the California company that was involved in this, you know, is a private entity and not a nonprofit, as I understand it, as is currently the model in Multnomah County. But that being said, if the model doesn't work, we have to explore all options. And if we have a very cheap option where you know, a private entity is paying for more than half of the costs and ongoing costs going forward, we should really look into the ability to have that kind of model.
Okay. And Meghan, I don't know if you saw that story or if you want to jump in on that or what your thoughts were.
Yeah, Medicaid rates are unfortunately in the behavioral health side very low. And so it does create providers not being able to accept Medicaid or really capitating what percentage of Medicaid they're willing to take. There are lots of conversations right now about how we could address that. And I do actually expect the 2025 legislature to specifically look at Medicaid behavioral health rates because I think it is impeding our ability to have access. But, you know, one of the things we have to hold our private insurers accountable too. And this is an issue that's come up. I understand there are complicated workforce related issues, but Oregon has done a lot to invest in behavioral health workforce. There is network adequacy requirements under our insurance commissioner that we don't enforce. So if you pay for private insurance, it says we've got these benefits. One of them is maybe outpatient treatment or inpatient treatment. And you call them up and you say, I need to access this, or you're referred, if that's a requirement under your insurance, you're referred by your primary care physician that you need this type of level of care. Good luck in Oregon finding it, truthfully. And that is actually not legal. You can't say you provide a benefit, but actually not have a provider available to do that. And it is a crisis on the behavioral health side. And so, you know, sometimes the county needs to step up, particularly for the Medicaid population, to ensure access. But on the private insurance market, people are paying for that. Employers or individuals are paying, believing they have a benefit that isn't real. Why are we not seeing MODA invest $7 million? They made $1 billion last year. They can't afford to give $7 million to increase their own capacity. You know, this is where I get it. I don't think it's easy to be a provider, but I also feel like, hey, insurers, you can't say you're offering a benefit that's not real. Now, I think
I apologize. Sorry. Great. Thanks so much. Sorry for our technical difficulties. Meghan, let me ask you this question about homelessness. And earlier this year, the county adopted its homelessness response action plan. Do you think it's a strong plan for meaningfully reducing homelessness? And if so, or if not, what do you like or not like about the strategy?
I don't think it's a thorough enough plan, and I don't think it has enough accountability built into it, which is something that seems to be a pattern that was brought up in audits internally by Multnomah County auditor. I think it is very general. And so it feels more of an aspirational statement than like if I was taking on a construction project and I was literally building out my plan that has timelines and Gantt charts, and I know who's doing what and how we're measuring success and what needs to be achieved by what benchmark. And I honestly feel like we need to go there. Sure, have an executive summary, but that's kind of what I feel is being delivered right now is an executive summary and not that robust level of planning that's necessary to really execute, but also, in a project, you're constantly checking in, saying, okay, here's where we're all at. Can we squeeze, to get back on track? Can we overlap some of this to pick up a few days? That's a construction analogy, but I feel like because we don't have the level of specificity, particularly by key population subgroups, so that we are particularly focused on a strategy that might be dealing with people who have experienced job loss. And so, how are we preventing loss of housing? That's one strategy. That's going to look totally different than how are we addressing people who've been chronically homeless for a decade and are experiencing untreated disability, mental illness, substance use disorder. That is a distinctly different path. That's probably the one I think we've had the poorest outcomes on, because we have not laser focused on have we built the right progression of options for people so that they're landing 2 years from now in a permanent situation where they'll be successful. We also are measuring success on a very point in time measure. And I really am advocating, we can't just look at, did I get you off the street one night? It's, did you engage? Are you still there? Where are you in 6 months? Have we transitioned you to that next more stable setting or that next treatment option for you? And then where are you in 2 years? Are people moving along in a progression towards stability? And that's really lacking. I joke, as somebody who worked in Salem quite a bit, there's this thing called key performance measures, which is always part of every department budget. And we all joke about them as like, ooh, what are the KPMs? Because it's like 100 long if it's something like Department of Human Services. But where is that at the county? I make fun of it as somebody who's had to go through that process, but now I'm like, oh, it is important that you're baking in how we're measuring success at every interval so that the people running these programs know what the mission is and can come back and say, this was how we were going to measure success. Here's where we did. Here's where we didn't. Here's what we did to adjust that. I think that's totally lacking.
Great, thank you. Vadim, same question for you about the Homelessness Action Response Plan. Do you think it's a strong plan for meaningfully changing our homelessness situation? And what would you, or how would you assess it?
It's really a plan to have a plan. It said we're going to decrease homelessness by 50%, which from all aspects that you can read into the plan was just a number pulled out of thin air. And then if you look into the plan, it basically says we're going to have a whole lot more meetings to talk about how we address the underlying issues of drug addiction, mental illness, and certainly housing is part of that as well. We're about 8 years into a declared housing emergency. We've had a very serious homelessness problem here for quite a while, longer than that. And last year, our own governor said that she couldn't give money that was set aside, millions of dollars that was set aside, because she couldn't tell what the plan was here in Multnomah County. The latest HRAP is not a plan. Again, it's a plan to have a plan. What we need is to focus on how we get people into services and how we measure the effectiveness of those services, if they're able to get into housing, how long they're remaining in housing versus maybe dropping off into homelessness again. And we can't do that until we have a real vibrant by names list program, as other cities do, where it keeps track of where people are, where they are in the continuum of care. And so if they fall out of the care, they can be instituted back into that system easily because we're keeping track of what's effective and what's not for them. And then we need to make sure that we do, for instance, what Washington County did. You look at their plan for homelessness. It wasn't 50 pages of large type with a general number. They actually laid out what is very similar to plans that other cities have, which is build out shelter beds. So they went from about 40 beds to 400. Instead of talking about how we'll build out shelter beds, they actually did it. In the course of 2 years, they increased their shelter beds by 10 times. And then they divided the county into 10 areas, and they sent out social workers, and they told people, we have a place for you to go. We'll have services for you at that place. We'll have housing services for you, mental health services, drug addiction services. Link people to those services that they need in order to better their life circumstances. But they said you can't camp here. And now Washington County has announced that they've basically conquered homelessness. They still have some tents here and there, but they've done a great job in getting people off the streets and into the services they need. Clackamas County has done a fairly decent job as well, about 60% reduction in homelessness, while every year we have an increase here. And so once again, I hate to beat a dead horse sort of here, but let's do what works in other places. We talk about evidence-based, but we never do what is evidence-based. We kind of, at best, move money out the door and hope somebody is able to solve the problems for us at the county. And at worst, we choose options that have failed in other places, like House Multnomah Now, which, in the first year did an absolutely terrible job with a lot of money and getting people off the streets and into housing, based on a program in Seattle, which likewise failed. So, part of it is we need better metrics. We need to make sure that we keep track. We need to make sure we have goals and not aspirations to create goals. But really what it comes down to is what's the best way to get people off of the streets and into treatment? Where has it worked elsewhere before? And this plan is not based on those sort of metrics.
How does one county commissioner inject change or accountability into the system, especially when you have a setup where the county chair has a tremendous amount of power? And Vadim, if you can go.
Oh, thank you. The first thing is there's a false assumption here that the chair has a tremendous amount of power. There's been some research into that by Stoll Reeves, a law firm here in town, that said basically what Chair Vega Peterson is doing is illegal. She's basically vetoing people's ability to put things on the agenda. So one is, we need to make sure that we hold the chair accountable to both what the charter says and what the rules of the meeting say, and not a secret executive rule, and allow a broad discussion and votes on proposals by county commissioners. And in fact, the DA and the sheriff can put things on the agenda as well. And then it's the ability to work together. And that's where my background comes into play, being a judge, having sat in a lot of committees here for the city, police oversight committee, very contentious committees, but being able to bring different sides together to share a common vision. And then making sure that we have community buy-in. What I saw downtown when the Behavioral Health Resource Center was put in, and honestly, the chaos that it created down there. A lot of people that live downtown, work downtown, had businesses downtown, started complaining about increased drug use, people threatening other people, increased crime. And that's because that center was opened up without any input from those individuals. Now, those individuals organized, and I worked with them in the Behavioral Health Task Force, and they went to the county commission meetings and they testified. A lot of these county commission meetings, you might have 2-3 people testify. There's not many people that know how that happens. And it's the onus of the county commissioners to be in contact with the community so that they know what's on the agenda, so they know what the plan is, so they know that if they're for something or against something, they know how to testify. And so one is working with the commissioners, and I'm glad to be endorsed by several commissioners. One is working with the city on issues that we need in order to make things happen. And I'm happy to be endorsed by mayoral candidates as well as city council people, because I know we can work together. We worked together in the past. And then that very important thing, which gets a lot of verbiage, but not real action, which is making sure we go out in the community to talk to people, let them know what's going on, and let them know that they have a voice. And if they want something to happen and it's not being acted upon, they can come and testify and make it happen.
Great, thank you. And Meghan, same question for you. How does one county commissioner create change or inject accountability?
Yeah, I have been pretty open about my support for changing the way that agendas are set. And I do not think the chair should have veto authority over that. I think that that's not democratic. And so, I will vote to allow discussion on issues I may not even agree with the proposal, because I think that that is healthy, to have open discussion. I also think there are a couple of different approaches. I hope to work collaboratively with the chair and every commission member. And I am interested, this to me is a full-time job. This is, and it should be. We should have county commissioners who are working full-time, putting in long days, rolling up their sleeves. And I'm really interested to work with anyone on the commission who wants to address these issues. And, I think getting to 3 votes is work, and knowing how to do that, even when you may be coming from very different perspectives. I have spent a lot of my career working with strange bedfellows to get things accomplished. I don't have any problem working with somebody who may come from a different ideological background than I do to get things accomplished. I've worked with, Senator Knopp on issues related to people with disabilities. I've, then gone over and worked with Representative Hua Win on other issues. I have no problem being willing to roll up my sleeves and work with anybody who's coming to an issue with a sincere desire to improve the situation. I also definitely am a believer in compromise. I think we've gotten sometimes a little bit stuck on, it has to be 100% my way or nothing at all. That's not really my approach. I'm a pretty pragmatic person. If I can move the ball forward and you can feel that you moved your ball forward, that's a win for me. I don't need 100%. I'm happy with 80, and I have a real track record of doing that. You don't pass 30 plus bills in Oregon. You don't, work with CMS to change how Oregon's delivering our Medicaid system with having to have everything your way. And I think my experience doing that is helpful. I have a lot of supporters who might think, I definitely agree with Meghan on this, maybe not over there, but I've enjoyed working with her. She works hard. She knows how to compromise and get things done. And I really think that that is the type of elected leader that we really need right now.
Great, thank you. Let's see. So I saw the City Club debate with you too, and one of the areas where you significantly disagreed with one another was the question of Sheriff Morrissey O'Donnell's decision to initial decision not to book people who are arrested for violating the anti-camping ordinance, and then her decision to change and start doing it for a 4-month period. Meghan, if you can go first. Are there any situations in which you would see that, or at what point, I guess, would you support the refusal of shelter to be something that should be arrestable or an arrestable offense?
Without any other offense related? I mean, I think a lot of these circumstances, people end up picking up other charges. I think we now have issues related to possession that could get somebody arrested. I do see resisting arrest coming up where that's the only charge somebody picks up. We see that with individuals who then end up on the aid and assist side, which means they're unable to aid in their own defense. So, it's funny. I did a ride along. It was a wonderful experience in Old Town. And, I asked, like, how do you think 4002 is going to change things? What do you think about, if we started arresting sit lie? And, I was with a very seasoned officer who was like, honestly, like, there's a lot of things going on. A lot of times there may be other factors. I am uncomfortable jailing somebody whose sole offense is homelessness and they just don't want to go to one of our options. I don't actually think that we have enough appropriate options for everybody. And there are rational reasons why somebody would feel unsafe in certain environments. That does not mean that they can stay where they're at. It's kind of like that song, you don't have to go home, but you can't stay here. That's my line. If we're going to move you, we may sweep you. You've been told. Do I want to book somebody in our jail? That's my line.
So,
I'm a no.
so would it be, do you think that it must always be voluntary?
What
accepting shelter?
Well, I don't think sweeping is a voluntary activity. I mean, literally physically removing somebody's possessions and moving them is not a voluntary thing.
Right, but in terms of accepting shelter,
them going through the booking process, no, I just don't. I think it's expensive, and I don't think it leads to any long-term outcome.
Okay, thank you. Vadim, what about you? What is your position in terms of just, at what point, I guess, should someone face being booked into jail for refusing to go to shelter? Let's say, for instance, Meghan made the point that some shelters are not going to be appropriate.
Well, I mean, we have a whole menu of options now. We don't have just congregate shelters. We have low barrier congregate shelters, high barrier congregate shelters, safe rest villages, TOS sites. We have church parking lots that have been converted to micro villages, and we have micro villages that are not faith-based. We have hotel rooms that are being rented. And the point is oftentimes the individuals that refuse to move are given a lot of different options before currently, I mean, up until very recently, at least, yeah, they're quote unquote swept, which is, they're moved. Now, if you prevent from being swept, there certainly would be criminal prosecution there if you just kept the people from moving your campsite. But that's the status quo. Okay, so if my opponent believes in the status quo that people should just continue being swept, then I guess that's a non-starter there. What we need to do is get people to services. And when you listen to the mayor who says every time we sweep a camp or every time we move somebody, we offer them shelter options, and 75% to 80% of the time they refuse to go, you got to wonder why. And the only way to get people there, is once again through kind of a deflection process, which is we have a place for you to go. We have multiple places. But if you refuse, you have to have a carrot and stick approach. And that stick, the only stick we have right now is the legal system and possible jail time. Nobody wants to put anybody that's living in the streets in jail, but we had 315 people die last year on the streets. We're talking about life and death situations here. We have 26 people that died of homicide on the streets. And of course, we also have people that were murdered by individuals living in the streets as well. So there's a downstream effect of a lot of these decision-making process. So when my opponent talks about, some places are not safe, the streets are not safe. And we're trying to get those people to safety. There's no murders at homeless shelters. We have people that are trying to help these individuals get into the kind of programs they need to get by and succeed in life and be in a better place. And yes, we need to have a system in place where there's repercussions. The Supreme Court has said that those repercussions are legal. States, very progressive states like California, urge the Supreme Court to allow them to use the criminal justice system to get people off the streets and into shelters. And that's what the Supreme Court decided. I think right now for anybody to say that we should not implement that in Portland when other states and other jurisdictions, including California, are doing just that, leaves people to die on the streets.
Thank you. I want to ask this question real quickly. Earlier this year, the county economist briefed commissioners on the 5-year forecast. He noted that the county is facing increasing personnel costs and is projecting significantly less general fund revenue due to the steep decline in downtown property values. And we could see a dip in the revenue coming into the general fund as soon as fiscal year 2026. Knowing that the county could soon be grappling with a budget shortfall, Vadim, please go first on this question. What actions should the county take to limit the impact to the public?
Thank you very much. So one of my talking points over time has been an audit of the kind of services we provided. If you all remember when the county gave, I think $1.5 million initially to Bybee Lakes, they asked for an audit of Bybee Lakes to make sure that they were spending the money well. We need to do an audit of the Joint Office of Homeless Services to make sure we have the ability to provide those service needs and understand what's working and what's not. We need to make sure that programs like Preschool for All are getting off to a good start and that money is not sitting around so that taxpayers are reluctant to stay in Multnomah County or effectively leave Multnomah County. What we saw was 20% of the high earners leave Multnomah County because of the high taxes that we have here and the decreasing standard of living. We need to entice people to move to Multnomah County to increase our tax base as well as businesses. And that goes hand in hand with some of the livability issues that we discussed today and to make the area more vibrant. We have a lot of green shoots right now. We have, certainly revitalization occurring in downtown in the OMSI area, 82nd Street, Old Town, a lot of places that are beginning to sort of thaw out from this deep freeze. We need to make sure that we create an environment where that grows because that'll provide a tax base going forward. But more than that, we need good planning. I talked about the audit as part of that good planning and having a forensic and performance audit of the joint office, $400 million, 10 times more than we had about 7 years ago. And yet we have more homelessness, more deaths on the street than ever before, breaking records every year. But good planning overall. And so from my background, I was a senior policy advisor for the head of an agency, a Medicare agency within Health and Human Services, where we actually had to look at the budget and make sure that things added up, that we supported the offices, that we had enough staffing in those offices, both good times and bad, whenever Congress didn't give us enough money, or sometimes they gave us more money and we could expand. That background is what I bring. I've managed offices both here in Portland and in Houston, Texas when I lived there. Once again, working with budgets, we had outlays of about $500 million. So have that experience to make sure we make the money add up.
Great, thank you. Sorry, just because we're running short on time, I want to make sure Meghan has a chance to answer. Question about, we could be facing a shortfall in the general fund revenue as soon as fiscal year 26. What should the county do to limit the impact to the public?
Yeah, I am really concerned about that, particularly the loss of families in Multnomah County and having a robust workforce that will hopefully attract new business. This is an area that I really think the city and county should collaborate on. I am a believer that, big cranes, if you have a lot of big cranes in a city, you've got a healthy city. I believe in growth. I believe in strategic investment. One of the things that I would really like to see, and this is kind of a nerdy construction thing, is one of the barriers to converting some of our commercial space into residential has to do with when you do that, you now have to bring something up to current residential code, which can be so cost prohibitive that the math does not work. I am advocating that we create a retrofit code so that we are prioritizing life and safety requirements. But many of these buildings are actually significantly safer than a lot of our residential settings today. They just would cost exorbitant amount to convert to 2024 code from 1995 commercial code. So I want to see, can we create a code that allows us to prioritize life safety, but be able to make that math work on conversion? Second, I don't think the footprint of existing businesses is going to fill all of this vacant space, and that is a crisis. So I'm very interested in what does it take to make Portland attractive for businesses to locate here. And, when it comes to the role of the county, what can the county do to that? I'm passionate about infrastructure. I want to make sure, I tell people Intel is not here because we have the best educated, data scientists. Sadly, they import a lot of that. Intel is here because we have excellent cheap electricity. And that's just factually accurate. So what do we have in our region? How do we make sure that this is the place that people think is still a cool place to live, has quality education? And when it comes to the county, it's how do we wrap around services, after school, preschool, childcare? How do we make this the place that people want to raise their kids? But also, how do we build housing to bring down the cost? Housing is killing us. And we've got to be firing on all cylinders so that this is a place business wants to come and this is a place workers want to live. And right now, I just don't think the math is adding up for businesses and for the employees those businesses need.
Great, thank you very much. I just want to give you guys one quick minute each to wrap up. Meghan, if you wouldn't mind going first on this.
Sure. I really look at Portland and Multnomah County as still an amazing place to be. I believe in this community. It has been a safe haven for me, and I know it has been for so many other people. I believe in us. This is a really challenging time, but we can rise to that occasion. And, I think in order to take this challenge on and really address these unmet needs, we've got to have people with a track record of doing that. I look at my experience, my career, and I have built things. I can point to 20 plus years of substantial accomplishments that have really improved the lives of Oregonians. I'm incredibly proud of that. And I want to bring that to the county. I think that type of an approach to problems, which is very solution oriented, very collaborative, very results driven, is what we need right now. We need to look at our problems and put real concrete plans together, measure them, adjust, be transparent with voters about what's going on. We've lost trust. I think that's real clear when I talk to voters, that people feel like, I don't think you're doing a good job, county, with the money that we've given you. So we got to start to adopt radical transparency. We got to be open to hearing things that are uncomfortable. We've got to be willing to take feedback, and we've got to go back and work incredibly hard for the people of Multnomah County to address these issues. And I am committed to doing that.
Great, thank you very much. And Vadim.
Thank you. For anybody that's sitting through this interview and watching it, I appreciate your time. The one thing that me and Meghan really agree on is Portland, Multnomah County is a great place to live. There's a lot of amazing things. I went to concerts downtown that Music Portland set up for free. I had a concert in my neighborhood where 30,000 people came to watch the Foo Fighters. It's an amazing place, and the nature here is beautiful. We just need to make sure we nourish it so it grows, and we and our kids have a safe and thriving place to be in. And what you see right now, hopefully at the end of the interview, is a pretty stark contrast about me offering the possibilities of change. We've had several things that have transpired in the last few years, including Measure 110 has been changed so we can use the criminal justice system to give people options to go into treatment. The city of Portland passed sit-lie statute unanimously. 5 commissioners and the mayor and 4 commissioners passed a sit-lie statute so that we can get people into housing, even if they're not making good decisions for themselves. The Supreme Court has passed or has made a decision that allows us different avenues. We have a lot of tax money right now for homelessness to address some of these issues, but we need a change of plan. And I've outlined what that would be. I'm working with individuals in the homeless shelter space. I'm working with businesses. I'm working with neighborhood associations because those people are doing the good work out there to make it happen. So it's not theoretical. It's what we're doing that is successful and will be successful going forward if I'm on the county commission. My opponent apparently wants to continue the sweeps. And that sort of thing is not getting us anywhere. In fact, it's the opposite. It's hurting people on the streets. We can't continue doing what we've been doing. And if you want to vote for change, then please vote for me.
Great. Thank you both for making time. This was a really good conversation. We appreciate it.